I'm Jack Patty, and this is the Senior Minute, successfully serving seniors.
Hello everyone, I'm Councilmember Shayla Lynch. Welcome to the Senior Minute. I have joining me today Hannah Johnson. She's a clinical associate professor at the University of Kentucky College of Pharmacy.
Thank you for having me.
Of course, thank you for being here. Why don't you tell our viewers a little bit about yourself and what you do here in the community?
Okay, my name's Hannah Johnson, and I am a clinical pharmacist and a professor at the College of Pharmacy here in Lexington. And I specialize in psychiatric pharmacy, so I work with our healthcare providers, so physicians, nurses, physician assistants, really all of the healthcare staff to help come up with the best medication options, counsel on medications, look at drug interactions, and then hopefully provide access for our medications for people.
Wonderful. What drew you to this field?
I have always been interested in science and math and medicine, and I really like that pharmacists are the specialists on drugs and medications, so we just have that unique knowledge and understanding. And the medications that I specifically know are really complicated, and so I really liked having that kind of understanding and then engagement with the community and patients and their parents, their family members, and everything.
That's wonderful. So the health system itself is a huge organism. What role does the pharmacist play in that huge system of the healthcare system?
So we can play a lot of different roles, and I think what's unique about the pharmacist is we're really accessible. And so you think about going to your pharmacy, and a lot of people know their pharmacist. Oftentimes we're the healthcare provider that they're seeing the most often because you're going in monthly or even more often to get your prescriptions filled. And so we're a great access point. And so we can help be kind of the liaison with other healthcare providers. So if you're getting your prescriptions filled, we can see maybe there's an interaction, or if we can see a change in how maybe you look, or we can do blood pressure screenings and that sort of thing. If we're seeing those changes, we can communicate with your healthcare providers and be that connection to all of them, because you're going to be getting prescriptions from your cardiologist, from your primary care doctor, your psychiatrist, and so hopefully if you're getting them all filled at the same pharmacy, we have access to all of those prescriptions, and we can help be that one touch point for all of those providers.
That's great. That's so very much needed.
Yeah.
What advice or tips do you have for seniors as they're managing their medications?
That is for seniors. So I think a lot of seniors can be on a lot of medications, so it can be very complicated. I think most recently I heard on average maybe 15 medications.
Wow,
yeah,
that's a lot.
It is, and so for anyone that's really complicated. And if you're taking these medications more than once a day, it gets even more complicated. So making sure that you have a good strategy on remembering how to take the medications and when to take the medications, and following the directions that are provided from your healthcare provider, from your prescriber, is really important. So whether that's asking for help from either your pharmacist or from a family member or a caretaker can be really helpful, coming up with a calendar or like the pill trays that you can fill out each week. That can be a really good way to help remember to take your medicines, and also know when you need to fill your prescriptions again before they run out. And utilizing one pharmacy can be really helpful, because they know where all your medications are coming from, and they can address any sort of drug interactions or contraindications that may happen because of certain medications that shouldn't be taken together. So I think that's really important, and understanding why you're taking the medicine is important, so that you're able to communicate with all of your healthcare providers the medications that you're taking and why you're taking them, and when you're starting to change those medicines, letting everyone know, because even small changes can be drastic in the senior population, just because they're more sensitive to some of the side effects and falls and that sort of thing.
Yeah.
So those are a couple of the primary things, and then just being consistent, you know, consistently taking your medications as prescribed, not coming off of them, you know, when you think you're feeling better or your blood pressure looks good today or your mood's a little bit better today, not coming off the medication because you feel or think you feel better,
Right.
but communicating with someone and coming up with a strategic plan on coming off of those medications or making any sort of adjustments.
That's really good advice, not just for seniors, but for all
For
of us.
everybody, yeah. I mean, even myself, anytime I have to take a medication more than once a day, it gets really complicated.
Yeah,
It's easy
yeah.
to forget. So
Yeah.
setting reminders can be really helpful.
Yeah.
That sort of thing. They have apps now to help you remember to take your medication. So
And that's what I use. I utilize my phone to remind me to take my meds.
yeah,
And it's very helpful.
Yeah.
Are there common questions that you get from seniors as a pharmacist that you would like to address with our public, especially since our viewers are mostly seniors?
Yeah. So we are getting a lot more questions about vaccinations, a lot more about like herbal and vitamin supplements. The wellness industry has really kind of blown up recently with all of the different supplements, and so questions about that are getting more common. And you know, I'm hearing that I can take this for this, and so making sure that you're having a conversation with your pharmacist or your healthcare provider about anything that you're taking over the counter, even if you think it's, you know, well, they just sell it at the grocery store, so it's got to be fine. Making sure that you're talking to someone about that, because a lot of these can have interactions with the medications that you're prescribed or also taking. So anything over the counter or vitamins, supplements, herbs, powders, tinctures, anything like that, making sure that you're talking to someone and having them look at that as well, and adding it to your medication list to make sure that it doesn't interact with anything or could cause any worsening symptoms that you might have.
And then you mentioned vaccinations. I know I think the majority of my life when I've gotten my flu shot, for example, it's been given to me by my pharmacist. So are there any vaccinations you recommend for seniors to consider getting annually?
Yep, so the flu vaccine is recommended annually, and then we're receiving, you know, up-to-date guidance on the COVID-19 vaccine. So that's also recommended, and then based on your age and if you have other chronic health conditions, you might be recommended to have other vaccines, maybe not annually, but, you know, based on that criteria. So you can talk to your pharmacist or your healthcare provider about those, and the pharmacy can generally give those. Other ones like travel health, you know, if you're going, if you're traveling, you might need some different vaccines.
Right.
And so pharmacists can also help with that. So it's always a good conversation to have. And then again, if you have access to, you know, a single pharmacy, they can keep all that on record too, and that can be really helpful.
Great, that's awesome. And as our time is wrapping up, are there any resources out there if seniors want to learn more about how the pharmacist plays such an important role in their health and their survival?
Yeah, so I don't know any specific websites off the top of my head. We have a lot of organizations that are here to support the community and give, you know, information about medications and things like that. So the American Pharmacists Association and NAMI, which is the National Alliance of Mental Illness, our psychiatric pharmacists help give drug information if you have questions about, you know, specific psychiatric medication. That information is there. And then your pharmacist or, you know, at your local pharmacy is always a great person to just walk up to, introduce yourself, ask them questions. They usually have a consultation room, and so you can ask for that consultation or give them a call and say, you know, when do you think you might be less busy, and we can sit down and chat and talk about my medication. So I think, you know, reaching out to your pharmacist is also a great place to start.
Okay, awesome. Thank you, Ms. Johnson, for joining us today. It has been a great interview. Seniors, you heard it here. Talk to your pharmacist, build that relationship, because they're a great resource, as we learned. Thank you for tuning in today to the Senior Minute, brought to you by the Senior Services Commission here in Lexington. See you next time.